So next is a bit of plastic surgery, skin grafts and flaps. So it's V43. So what is a skin graft? A skin graft is a piece of skin that is completely separated from one part of the body, which is called donor side, and transferred to the wound or defect, which is called recipient side. A skin graft needs a healthy vascularized recipient side bed, as it relies for its nutrition and vascularity on the recipient side. If a skin graft is placed on an avascular tissue such as bare bone, tendon, cartilage, the graft is likely to fail. Skin grafts can be used only if the wound bed can provide enough nutrition to sustain the graft, allowing it to take. Describe the difference between a split thickness and full thickness skin grafts. The split thickness skin grafts contain epidermis and the thin layer of papillary dermis, oftenly harvested as a sheet from the thigh using a dermatome, a Humvee knife, Watson electric. And these devices allow adjustment of the width of the skin graft and thickness to allow for accurate graft harvest. They are often meshed either manually by making a fenestration with the scalpel with a blade, or more often by using a meshing device. Meshing a graft allows it to expand. Fenestration allows tissue fluid to drain, allows the skin graft to be contoured better over the uneven surface than the sheet graft. Full thickness skin grafts contain epidermis and all of the dermis. So full thickness skin grafts are often used for the smaller defects. Donor side is limited to the areas with enough excess skin to the both harvest a graft, close the defect directly. These include parts of the neck, behind the ear, and the groin. Full thickness skin grafts tend to give a better cosmetic appearance, and they contract less over time. How do skin grafts take? So there are stages. So initially, once the graft is laid down, it do fibrin deposition, then plasma imbibition, where the graft takes the nutrients passed directly from the recipient bed into the graft, and then inosculation and revascularization, and then graft maturation. So these are 4 steps in the graft take. How do skin graft donor sites heal? So they heal from the residual skin. The split skin graft donor site is left raw under special dressing like caltostate and allowed to heal by second intention from the residual epithelial elements. This process takes 2 weeks. The full thickness skin graft donor site is closed directly. What are the causes of graft failure? In ideal condition, the most skin graft will take. Graft failure is often due to shearing and graft displacement, infection, if a physical barrier such as hemoglobin barrier between the graft and the bed. So that's why the special dressings are used to anchor the graft to the skin site for first week, so to decrease the shearing and reduce any dead space between the graft. In contaminated wounds, infection must be treated before applying the skin graft. When infection is still there and graft needs some tissue coverage, then the answer is the flap. So what is the flap and when would you use it? A flap is a block of tissue moved from one side to another that is always connected by the blood supply, which is called vascular pedicle. Flaps can be classified according to their blood supply, like axial and random pattern, method of transfer like advancement flap, rotation flap, transposition, interpolation, and free, and tissue composition like skin, fascia, muscle, bone, or combination of these, such as the fasciocutaneous or myocutaneous. I would use a flap to cover exposed bone, vessels, implants, open joints, open fracture, and wounds that are too large for primary closure and not appropriate for the skin graft. What is the difference in blood supply between the random and axial flaps? So random based on the dermal and subdermal vascular plexus. For example, many local flaps on the face are random pattern flaps, and axial based on the named arteries and veins. What is the difference between transposition and interpolation flap? So transposition is a triangular, square, or rectangular flap that moves laterally about a pivot point into an adjacent defect. Interpolation is a flap that moves laterally about a pivot point into a defect that is not immediately adjacent. The pedicle is passed over or under an intervening skin bridge. What is Z-plasty? It's a technique that uses 2 interdigitating triangular transposition flaps. It is used to lengthen a linear scar, break up a linear scar, or reorientate a linear scar. So this technique also influenced by the internal angles of triangles. A Z-plasty with internal angle of 30° can result in 25% lengthening, while a Z-plasty with internal angle of 60° can result in lengthening of 75% of the scar length. Name some pedicle flap that are relevant to the general surgeon. So LD flap, latissimus dorsi flap, taken down from the back with an ellipse, and the pedicle is called thoracodorsal pedicles, and then VRAM, vertical rectus abdominis myotonis flap. It is a myotonis flap based on the deep inferior epigastric artery. It is commonly used in the reconstruction of perineal defects following the APER. And then is the pectoralis major myotonis flap that is used for chest wall reconstructions or the head and neck reconstruction. So what is a free flap? A free flap is harvested from a side that is distant to the wound or defect and is raised with its own blood. With its blood supply, which is also dissected with the help with the flap. This pedicle then divided and the artery and vein reconnected to the matching recipient side vessel using microsurgery. So commonly used free flaps includes the deep inferior epigastric artery perforated flap. This is used in the breast reconstruction instead of tram flap. The advantage is there is no weakness in the abdominal wall. And then is the anterolateral thigh flap. Based on the descending branch of the lateral circular femoral artery. It is commonly used in the reconstruction of the head and neck cancer resection defects and also used in the trauma construction. And then is the radial forearm flap or FF flap. This is a fasciocutaneous flap based on the radial artery. It is commonly used in the reconstruction of the head and neck cancer resection defects, and as it is thin and pliable, it is particularly useful in the reconstruction of the intraoral defects such as the tongue and the floor of the mouth. Thank you.